Hi, I'm Dr. Marc Scheider. Welcome to my office. I'm an orthopedic surgeon with the Christ Hospital. We want you to have the most enjoyable and best experience with us as possible. If you have any questions, please don't hesitate to ask. We're always looking for ways to improve your experience and the office. The rotator cuff are the four muscles and tendons that basically make the shoulder work. And so if you look at the ball and socket of the shoulder, there's a cuff of tissue, these four tendons that converge. And that's how when the muscles fire and activate, the shoulder lifts with strength in overhead activities. There are a variety of different conditions that can affect the rotator cuff. There's basically a spectrum of disease from a tendinitis to a partial tear to a full thickness tear. And these can be traumatic or degenerative type conditions. A rotator cuff tear is a tear in the tendon of the rotator cuff, and there are four muscles and tendons that contribute or make up the rotator cuff, and so any of these or all these can be affected. So a small tear just affects one tendon of the rotator cuff. A medium tear usually affects two tendons. A large tear can affect three or four tendons, and then there's what we call a massive tear where almost the entirety of the rotator cuff is torn off the bone. A rotator cuff tear is treated in a variety of ways. Some of these are non-surgical and some are surgical. So it doesn't mean that every rotator cuff tear requires surgery. There are traumatic tears, oftentimes those do require surgery, and degenerative tears where the rotator cuff just simply wears itself out with age and wear and tear and time. So not all of those degenerative tears require surgery. It depends on how big the tear is, how much of the rotator cuff is actually torn, how symptomatic the rotator cuff disease actually is. And so often we can treat rotator cuff tears, smaller tears, conservatively, sometimes with injections like cortisone or medications like anti-inflammatories or physical therapy and or modification of your activities. However, if the tear remains symptomatic with conservative treatment or with traumatic tears, then these very well could require surgery, and we do arthroscopic surgery to fix those. So most rotator cuff tears can be repaired arthroscopically, and that is surgery that involves placing some small poke holes around the shoulder, usually about the size of a pencil head, and we put a camera inside the shoulder and we look around diagnostically to confirm the condition and the disease or the extent of the tear, and we're actually able to introduce instruments and devices to fix or sew back the rotator cuff to bone, which is what happens with a rotator cuff tear. It's actually torn off the bone. The most common risks of arthroscopic shoulder surgery are actually fairly small. There's about a 1% chance or less of getting an infection. We do give you antibiotics during the operative procedure, but you don't need them before, you don't need them afterwards. Shoulder stiffness can occur with surgery depending on how extensive the procedure is or maybe your propensity to developing scar tissue. Usually that can be worked out with physical therapy, but that's somewhat variable, in terms of how long it takes to improve. The other things is that, with rotator cuff repair, there isn't a 100% healing rate, and some of that depends on whether it's a degenerative wear and tear type process, so the quality of the tissue, your compliance with the rehabilitation process, or if there's some kind of re-injury, and also the size of the tear can affect the rates of healing.